Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Hello, Dr. Stephen Brownstein here, and I am the host of the Dynamic Radiologist Podcast. Through this platform, I have the great honor to interview top leaders in health and in business to discuss what they are doing to change the world. Some of the amazing guests that I've interviewed include Dr. Jeffrey Kronk, CEO of Spinal Kinetics, Smart Injury Doctors, and Smart Injury Lawyers, Dr. Mike Carberry, CEO of Advanced Medical Integration, Dr. Donald DeFabio, and Howard Reese, CEO of the Teledentist. This episode is brought to you by Dynamic Medical Imaging. I started this organization 16 years ago and have experienced consistent growth and opportunity ever since. We have the only phonar upright MRI in central and northern Jersey. We've had patients consistently coming to our center from over 20 miles away. Over 25% of our patients are either claustrophobic or have failed to have their MRIs completed in a closed unit. They have come here to have their studies performed in the phonar upright MRI. We've had over 3,000 doctors from New York, New Jersey, and Pennsylvania refer their patients to us. What is really telling, though, is that those same doctors who have referred their family and friends have come here for their own imaging needs. Please check out our testimonials at the website dynamicmedicalimaging.com and see for yourself what your fellow patients have said about their great experience at Dynamic Medical Imaging. Our second sponsor is brought to you by Spinal Kinetics that I started over 10 years ago. We help medical providers of all specialties evaluate for the presence, location, and severity of spinal ligament injuries. If you do stress radiographs in any format, then you can send them to our trained doctors who use our special technology. Spinal Kinetics developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion problems that occur with a spinal ligament injury. If you have any questions, go to www.thespinalkinetics.com or email support@spinalkinetics.com. Well, today I have the great pleasure of interviewing one of my close friends, Dr. Donald Antonelli. Don is a chiropractor for over 2 decades in Union, New Jersey. He treats the whole family from the young pups to the seniors, and he specializes in general injuries in neck and lower back, as well as the entire musculoskeletal system. And Don is like a Jersey guy like me. Went to Union High School, Seton Hall Prep, Seton Hall University, and went to New York Chiropractic College. He's a member of the Association of New Jersey Chiropractors, and he has a certificate in Chiropractic Sports Medicine. He's a past team doctor for Union High School, their baseball team, and participates in a lot of the Union youth programs and community. Proud father of 3 daughters, and again, a good friend. Hey, Don, how you doing?
Hey, Steve, how you doing? Thanks for having me.
My pleasure. So I always ask my chiropractic friends, why did you become a chiropractor?
Well, Steve, actually, it goes back. My family has always had a long history with chiropractic, going into the 1950s and the 1960s. We all owned, my uncles, my father, my grandfather, they owned small businesses in Newark and carpet flooring businesses. So there was always back pains and back aches. So I was always pretty familiar with chiropractic. But I would say one of the defining moments was my brother, who was actually a surgeon during junior year of high school at Seton Hall Prep, hurt his back pretty bad, and we couldn't play baseball at the time. And not playing baseball in our family was almost like missing church. It was really bad at that point, So the school made him go to their orthopedic doctor, and 3 or 4 days later, against the school wishes, my mother said, "Heck with it, we're going to take it to the family chiropractor." And 3 or 4 days later, my brother was catching again, and it was my first introduction to, wow, how did that guy do that to my brother? And then fast forward to junior year of college, I was thinking of going to dental school. I was kind of undecided, and my brother and another good friend of mine, Jackie Bringiel, who's a pediatric oncologist in North Jersey, said, "Hey, Don, how about a chiropractor?" So I started going to my brother on his visits. And I was like, that's something I could do, something I would really like to do. I get to work with my hands. I was intrigued with owning my own business, and just the thought of trying to heal the body without traditional medications and surgeries was an intriguing route for me. And I'm really happy 28 years later, I'm still amazed sometimes doing it, the different types of things we could treat as chiropractors. years, so
it's well, my history that I've been friends to your profession when it wasn't politically correct to be friends with your profession, and I think now everything that your profession stated but couldn't actually prove per se is now being proven to be true. And all innate intelligence and the microbiome and all these things that from inside out, from top to bottom, that Dr. Palmer preached. All those tenets that you practice and the profession practice seems to be coming true. That it's nice that you actually have the science to back up the theories,
right?
And it's pretty cool. And I know they just published a book on basically the AMA versus Wilkes, and all the nonsense that went on. But I tell my friends that you guys shouldn't consistently consider yourself victims. You're actually the victors.
Right.
And I think now more than ever, there's been a great relationship built between all practices, whether it's AMI, Advanced Medical Integration with Dr. Carberry, or private doctors aligning themselves with medical doctors that are on the same page to help their patients. Right. So whether it's a integrated practice under one roof, or integrated practice with multiple offices, I think people are starting to talk the same language, that they put patient-centric rather than egocentric. And the biggest fear years ago, chiropractors saying to an orthopod, is he going to steal my patient or badmouth me?
Right.
And obviously everybody had bad experiences with that, but through the years, alliances have been struck, and respect has been grown for everybody, and the patients benefited. And I think as we move forward, chiropractic with regenerative medicine is going to be in the next 2 to 5 years the main thing that now we can do something to help heal the body, both from inside out as well as from outside in.
Correct.
And that's why I feel, and that's why companies like Boston BioLife that teaches doctors about regenerative medicine is huge. Joe Krieger there, and I just think that that's the wave of the future, is chiropractic integrating within the medical profession. But my biggest fear for your profession is that it gets completely assimilated, and like the osteopaths, where osteopathic manipulation is now an elective in school.
Right.
There's some talk that Parker wants to have two different where one where the chiropractor learns manipulation, the other no manipulation is taught. I said to myself, you guys had a hard enough time explaining what you did before. Now what are you going to do?
Right.
And be a glorified MA, glorified CA, glorified nutritionist. I remember someone asked me why I love chiropractors so much. I said, because they get people better.
Right. Well, Steve, it's funny not to cut you off, but what happens here is that it's funny because I still keep my name, even in my practice, Antonelli Family Chiropractic and Physical Therapy Center. I keep the word chiropractic in there, and I've noticed over the 28 years there's been a little bit of loss of using that, whether there's health and wellness centers or rehabilitation centers. So I think and I think it's an attractive point for the overall public when they see the word chiropractic, because in 28 years it has become more of an accepted form of treatment for lower back injuries. And I can remember even 28 years ago, whether there was scientific validity of manipulation of the lower back and how, whether that was an effective form of modality for the treatment of low back pain. But you are 100% right. Being even specializing a little bit in sports, having interpersonal relationships with orthopedic guys, neurologists, your MRI facility. I've always, even when I first started my practice, looked for what I would consider the best orthos, neuros, pain management guys in the areas, because, you have a kid who comes in from high school playing a pretty significant low back injury for football. You want to do an MRI sooner than later. So you where the path is, especially in a short high school football season, of where you're going to get him, and have that orthopedic opinion and have that relationship with the school trainer. So, but I do agree, losing the little bit of chiropractic identity is a little bit worrisome, as I see in my profession going forward. But in the same sense, we've come such a far way in terms of the overall interpersonal relationships that you have with other practices, and I've always enjoyed that. Tell you the truth,
I think now you have more to be afraid of from within your profession than outside your profession.
Mm-hmm.
Oh, you have 18 different chiropractic schools, or 14, whatever, and
Mm-hmm.
they all have their own agenda, and they can't agree on anything. And so it's like 14 different tribes, and there's no chief running the. It's like trying to herd cats. But that being said, chiropractic does help, and you do get to spend a lot of time with your patients and get to know them, and their family, and their highs and their lows, their peaks and their valleys. You become like Marcus Welby, that you can spend the time to get to know your patients, and
Right.
that's kind of forgotten now because of reimbursement. MDs have to, it's like in and out. If you have a pain in the right ear, they don't bother looking at your left ear, and God forbid they take out the stethoscope.
Right.
And it's just based on, because of reimbursement, you have to see a lot more patients to make, half of what you made before.
That is true. You see more patients each year, and probably make less money at that point. So it becomes, that's a difficult issue. But I think, listen, I think that happens across the board for a lot of businesses in general. But yeah, I've always enjoyed the family part of being a chiropractor. I have a funny saying that when I ask patients who were refused how they got referred to my office, and 25 years ago, it was all word of mouth. Oh, go to Dr. Antonelli and my cousin Dr. Halter. They're good chiropractors, or they're good guys. And now I get, seems 90% of my referrals come from some guy Google and some girl named Yelp, and I've never met either of them. So it's amazing how the referral base has changed.
No, it's definitely changed. We've obviously noticed it ourselves. That's why we spend a lot of time and money updating our website. And a lot of our patients, as I said in the intro, are claustrophobic, and because the phone is most of the patients sit watching TV. And I was in Hackensack the other day, and they had a big billboard about the open 3T and claustrophobia. Well, you still, like the white part of the Oreo cookie, you still have the camera above you. So how open is that? You're not in a coffin, but you still like squeeze like a sandwich.
Right.
So
I've always appreciated your facility from that standpoint too, though, Steve. Even if you had that acute low back pain, you want to get that person in that MRI a little quicker. I mean, for them to lay supine for a half hour, they can't stay still a lot of times. And at least in the seated position, and I know you guys go a little bit recumbent, people could actually handle a little bit more of that position, because their knees are flexed, a little less pressure on disc, a little less interthecal pressure in that position. So I always found all of a sudden your facility, you're able to kind of, I'm more apt to refer, in more of that acute hot low back situation, seems to get the picture a little bit easier without movement.
Well, actually, in the sitting position, it actually exerts the most stress and force on the spine. That's why we're able to see things that you can't see in a recumbent. It's like a toothpaste that, now in the upright position or sitting position, that toothpaste is being squeezed. So we see bulges and herniations become more conspicuous and more obvious to the eye. And also, herniations are like real estate. It's what they're pressing on. It's not as much size. It's, size matters, but it's more location. You could have a small herniation next pressing on a nerve root, and you have problems, but you could have a 25 centimeter L5S1 disc that's not pressing on anything.
Right.
So, it's important to identify exact location and what it's doing to its neighboring structures that we do. And, obviously with spinal kinetics, we're able to see the non-disc connective tissue injuries that most MRIs don't pick up. So it's pretty neat to have all the tools that we have here And it's even more neat to have great docs like you refer to us, because basically we're a referral business. We don't have, although with our center on the back side of 22, I always say I could probably make more money selling hot dogs and water at rush time out there than doing medicine. But we've been here for 16 years through the grace of God and through great doctors like you that support us, and always thankful for that. And, you make my day when I see your case. It's I know I'm helping you and help your patients get better, because at the end of the day, that's our job, is to make patients' lives better so they can enjoy their kids, they can lift their kids up, they can play sports, they can do whatever they're doing. They're at work, they're more efficient. And to kind of circle back, that they actually found chiropractic is more effective and more efficient than any other modality by itself, and when combined with other modalities, it's actually less efficient. So, chiropractic is definitely a valued treatment option for people that have been injured. You're one of the best. So, if I was a patient and either I called the office or I looked you up on your website, what differentiates you from all the other 25 chiropractors in Union?
Well, from a practical standpoint, I'm big into the same day appointment. I mean, what's the sense in you having pretty significant back pain and I'm saying I could see you in a week? So I've always tried to kind of maintain the availability of same day appointments. That's number one. Another, from a practical standpoint, we are open at 9:00, 5 days of the week, plus Saturdays. I've always maintained a pretty late work schedule, figuring most people, especially in Union, have a lot of people traveling into New York City. They're not getting home till 7:00, or even the traffic, if you're coming from Linden, you know how that could be. So we always maintained a pretty convenient schedule for patients. But from a practical standpoint, I mean, really, I think what makes me special, and I know this is going to sound a little off, but I keep it simple. I mean, we do an exam, we take an x-ray, we do treatments, we do a lot of hands-on therapy. We're going to do our best to help you get your injury better and then make decisions from there. I always had a saying that I could help you even if I can't help you. I can refer you to this doctor who I think is good, or this physician that's good. So we individually try to take a person from A to Z and get them where they need to be so they could get back to a normal life and function properly and really try to heal their injuries. So, other than what makes us special, I just think we provide the best quality healthcare that we possibly can. I've always said, you don't go to Disney World and say, hey, this is a nice park. I just always had the impression when you walk into my office, our goal is to exceed your expectations from a health facility. And so again, I always try to keep it simple. Take care of people like you would your mother, and everything will be okay.
Yeah, I'm just in the process of reading a book, The Power of Moments. And, the first impression that patients have with your practice and the last impression as they leave the door and everything in between are all important. So, training your staff to treat them and greet them like it's their mother or their father.
Right.
And as they go, make sure that they know that you're here for them. And as you said, same day. You hurt your back, I'll see you the same day. So you're the same day doctor. So no, that's pretty neat, and it's great. So I know you went to Union High School. I don't know whether you know it, but my wife went to Union High School. And two of my best friends went to Union High School.
Right.
So it was funny. I went to the class reunion, two of the class reunions, and it was pretty neat. My friend Neil, that I knew since I was 6, and my friend Gil, they both graduated the same year with my wife. So it was pretty neat. Even though I went to Hanover Park, I felt like I graduated from Union High School as well.
Right.
So, so what position did you play baseball?
Well, Steve, it's funny. I not to backtrack on you, but I went to Union Public Schools up until 8th grade, and actually my parents sent me to Seton Hall Prep, so I never made it to Union High School. I ended up going to Seton Hall Prep for 4 years, and I was so angry. I wanted to play Union High School baseball with all my buddies more than anything else. But after my parents hit me with, you have to wear a blazer. I was like, are you kidding me? And then they're like, and then they're like, it's an all boys school. I was like, this is a joke. But anyway, they made a deal. They expressed to me that Seton Hall had a really good baseball team. And my other deal was I didn't have to go to church anymore, but not realizing that I was going to Catholic school anyway. So there was going to be class church once a week anyway. So, I ended up going to 4 years. So I was a pitcher and an outfielder at Seton Hall Prep. And then I went on to play baseball at the Seton Hall University. And, same thing. I got not a full scholarships, but I got academic scholarships. I got some athletic scholarships. And the claim to fame is my catcher was Craig Biggio, who's in the Hall of Fame.
Oh, cool.
Played first base, and John Valentin was playing shortstop. And I can remember at one point watching an all-star game where all three of those guys were playing, and I'm contemplating maybe I should have studied less and run a little bit more, So
No, had great teams and a great coach too. Who was the coach?
The coach was Mike Shepard Sr.,
Right.
who I think had 999 wins at Seton Hall University, but his son, Mike Shep Jr., was our high school coach and our Legion coach, and actually, to this day, I think John, who I played with, John Shepard, is one of the coaches at Bailey Ellard or one of those schools. And Robbie, his youngest son, who's good friends with my youngest brother, is now the coach at the university. So, played a lot of baseball back in the day, but always played baseball in the summer here in Union with all my buddies.
Oh, that's good. So I grew up in Newark, and we moved up to East Hanover. So I was trying out for Little League. I used to have a nasty curve, even at 10 or 11, but once in a while the curve didn't curve. So they banned me from throwing the curveball. I didn't have any sticky stuff on my fingers. My spin rate, no one knew about spin rates then.
Exactly. You had there was, with this whole controversy going on, there was always a guy who at a candy store near Seton Hall Prep or the university at the time, and he was always trying to convince me to, hey, you should put a little glue on your hand. Every time I walked in there, and I was like, what are you talking about? Spitballs are illegal. You can't do that stuff. But now I guess it's amazing how far it's come in terms of, the spin rate in the sabermetrics. And I would have eaten that up if that was around. When I was a pitcher, I loved the stats. I loved all the analysis, but it was kind of old school, put your arm in this angle and just throw as hard as you can. But it seems especially pitching has become almost like a scientific kinetic type of experience, body motion. And I quite honestly, it's another reason what attracted me as being a chiropractor. I love the study of motion. I love the analyzing the kinetics, and that always intrigued me. And one of the other things I always found that attracted me and decided where I wanted to go as a profession too. So,
well, Einstein had it right. Nothing happens till something moves.
Yeah, you're good. That's
did you see this clip with Scherzer and the Phillies? They literally checked him 4 times, and the batting instructor Long, who used to work with Girardi, they almost came to fisticuffs because it was just nonsense. Scherzer was about to take his pants off on the mound. You want to check me here too? It's
right.
Nuts.
Yeah, they call him Mad Max, right?
Definitely affecting the mental state of these pitchers. Garrett Cole is not the same. Whether you use stuff or not, it's just the fear of being called out. I think they actually found somebody and they kicked them out for 10 days. So they actually found somebody, but it's definitely, strange. And the Yankees suck this year. Excuse the French. Abysmal. Every time I turn on the TV, the other team hits a home run. So I don't even watch them anymore.
Yeah, listen, I'm not a fan of the Yankees makeup. I mean, they define all or nothing. I mean, how many times can you watch Stanton hit homers in meaningless games and then strike out 7 times with the man on second base and not even advance the runner? It's the new game's a little annoying.
No, absolutely. So, what else you want to talk about, my friend?
Well, I mean, I could talk baseball and golf for the next 3 hours, but I don't think too many of your podcast people would be, just from the standpoint of, from a professional standpoint, like I said, I look at these young chiropractors out there, and it's a little bit more struggling from a healthcare standpoint and the insurances, and it gets a little rougher each year. And how do you make a niche for yourself in terms of the practice going forward? And that's you really, to be a chiropractor for these young kids, you have to really look at yourself in the face and say, do I want to be rich, or do I want to be a chiropractor? Do I want to help people, or do I want to, where do I want to be on that totem pole? And then you have to look at yourself in the face and say, I have to be comfortable with being a successful business owner, running a practice. I mean, all those are major decisions because, from an employment standpoint, even physical therapy or osteopathic professions. I mean, there's more choices, even nurses and nurse practitioners and physician's assistants. There's more income streams or income choices. But when you become a chiropractor, you have to really it's a great profession. You help people. It's like you said, the interpersonal relationships you develop with people, the families, the long-term relationships, all that stuff is great. But you have to really kind of understand you're going to be out there on your own from a business standpoint and be comfortable running your own business. So,
and there's, it's kind of almost a tyranny of choice, because a chiro has a number of different pathways to, you can be an associate and then go out on your own. If you go out on your own, do you want to become part of a large group like Health Source? And then, or do you want to be an integrated practice like Advanced Medical Integration? Or you just want to work for the joint? Or my good friend Stan Pierce is launching another franchise called Epic, Upper Cervical, and he's developed technology that just got a patent approved that can render three-dimensional delivery of the electromagnetic pulse to create a cervical junction. But the equipment is expensive, and it's if your profession suffers from anything, it's a bright shiny object syndrome, because they're always looking to try to get one up on their next door neighbor chiropractor. The latest billing software, the latest technology, the latest supplement.
Right.
It's sometimes it's not so much a rush to the top, but kind of a rush to the bottom. But
Right. Well, it's funny you say that a chiropractor is like, I guess in Latin, the doctor that practices by hand. Yet every chiropractor is looking to kind of buy the newest laser technology, kind of
actuator,
all these different things. And yet it's a simple practice. Keep practicing with your hand. Not that you shouldn't have every tool in your toolbox, which we have here, which I think is an important part of the practice. But yeah, again, getting back to what you asked me, what keeps you special? I think people go to a chiropractor because they're looking for somebody to help them with their hands, to get them better. And I think that's keeping it simple in terms of how you practice. I think that's an important part of what we do as a profession. And I hope we continue in our schools, continue to push that forward, that it's the healing of the hands, not to get too esoteric and holistic, but that's what we do, so.
No, absolutely. Unfortunately, you pay the price, because I don't know any chiropractor that doesn't have at least some herniated discs as a consequence of using your force, and it exerts pressure on your spine. And it's a occupational hazard, even though they teach you the proper technique, whatever. Invariably, I don't think there's been one chiropractor who's come here for their MRI that I haven't found at least one disc herniation.
Right.
So I understand why they're looking to minimize the hands-on and supplement it with technology, just to have an increased longevity of being able to practice.
Oh, absolutely. Absolutely. Yeah. As you get older, and I'm 55 at this point. I do gravitate toward the more the light force techniques and stuff like that. But like, again, you have every tool in your tool bag, and you have I'm sure somewhere in your computer is a is my positive disc MRI somewhere at DMI over there. So I recall that very well, So yeah, we that and carpal tunnel are the big two things that
absolutely.
shoulder issues, So
it's going to be interesting the next 5 years, because I think there's going to be, as I said, more integrated practices and the use of regenerative medicine. I think that, and also nutrapharmaceuticals, supplements that will, address the microbiome, and also increase your vascularity, the microvasculature health. Everybody concentrates on the macrovascular, your aorta, the coronary arteries, your carotid arteries, but the microvasculature is like the early warning system. Mm-hmm. And there's technology that's coming on board pretty soon that I'll tell you about, that we can actually measure the health of your microvasculature, and there's actually supplements to replenish your microvasculature, your glycocalyx. Mm-hmm. And they actually found that with COVID, people that were on ventilators lost 75% of their glycocalyx, which is the lining that protects your endothelium. Mm-hmm. And if you didn't get on a ventilator, 50% of your glycocalyx gets reduced. And I had COVID, and I went on the supplement afterwards for double for the first 4 months, and then the standard, and my PO2 is still 98, 99. So I know it works. So there's a lot of neat stuff coming out on the horizon for all of us. And the main goal is to make patients better, quicker, so they can get on with their life and their occupation and hobbies and whatever. And thanks to you, my friend, you're doing a great job. And more importantly, you've been a great supporter to our center here, and a great friend to me for all these years. And you're only 55. I feel like an old fart compared to you. It's been a pleasure, my friend, and I know you have a busy office waiting for you, so go crack some backs, and I'll talk to you soon, my friend. And I'll let you know when the link's ready, and you can post this on your website. And I hope more people can get to go to Antonelli Family Chiropractic, the same day doctor.
Thanks a lot, Steve. Thanks for having me. All right, enjoy the day.
Okay, my pleasure, my friend.
All right, Steve, I'll see you.
Okay, bye.
Thanks for tuning in to the Dynamic Radiologist Podcast. Make sure to click subscribe to get updates on our latest episodes.